with actual for healing. And today I have a special guest that I want to introduce you to take. I'll take it away.
Hi, my name is Kyla. I'm a registered nurse. Been a nurse since 2013. I've worked in almost every department, starting on the floor with inpatient bedside care, and I currently work in emergency department.
Very good. Also, what have you learned from your different jobs in nursing?
The biggest thing I'd say that I've learned is that patients need to make sure that they advocate for themselves. Being in the hospital, especially in the emergency department, can be a very scary time. The things are happening very fast, very rapidly, and you can forget the things that you may have wanted to know. Get a piece of paper, use the note application in your cell phone, write your questions down so that when the provider does come in there, you are not scrambling to remember the things that you wanted to know. Refer to your list and get all your questions answered. The more you know, the better informed that you are. You can make better decisions for yourself.
Okay, I would say also empower the person who is with you, write things down, ask questions, or your scribe. And by that, I mean they can write things down. They don't have to say anything, but they can write things down and they can listen to what is happening and what is being said. That's some great advice. What would you say is another way to engage when you're there?
One of the biggest things also is to please let us know if you need assistance. Hospitals have a wealth of resources, some that I didn't even know until I was in the game for 10 plus years. There is usually always something that we can do to assist you, whether it's affording medications or getting your follow-up care. Please let us know if there's anything that you might need assistance with.
Okay. The next question is, I haven't written it up so I don't forget. My next question is, know who your important person is.
Oh yes, that's very important. While you're in the hospital, you're focused on your recovery, your healing, and you're getting 1,000 phone calls because your loved ones wants to know how you're doing. That can be a little bit overwhelming, especially when you're focused on your healing. Have that one person that you are relaying all that information to, and then they can disseminate that information to the rest of your loved ones.
Okay. That's a good tip. What else would you say would be helpful?
If possible, when you're going to the hospital, try to stay within the hospital system that you usually get all of your care in. Reason being is because they have your medical records. The providers that are used to caring for you or that have done procedures on you in the past are familiar with you and your case. If you go to a hospital system that is outside of the one that you normally go to, they may not be able to get in contact with your providers in a timely fashion, and they may not be able to transfer you to the hospital that you would prefer to receive care in. So when possible, try to stay within that same hospital system that you're used to going to.
Yes. Oh, that's good advice. A lot of times people can be nervous or not thinking. So if you think through those things earlier, it will help you.
Yeah. So have a plan in place beforehand, especially if you're someone that has some chronic health issues. If you are frequently having to see your providers or go to the hospital, you should have someone that knows which hospital system that you go to, someone that can access your medical records, know what your allergies are, know what your medical history is. I like to save it in a file on my computer and share it with my loved ones. A Google Doc is a great way to be able to share that with people, especially because sometimes you may not be able to express what's going on with you at the time and your history. So having that in a centralized area with someone that can access it to be able to relay that information for you.
And know what medications you're on. And write that down. So you may not remember. They're going to ask the question. They'll ask a lot questions. So I had a stroke on AVM stroke on January 27, 2023. So if you do not understand me, in the comments below, say what it was that you didn't understand. Feedback is a gift. It's not a credit. It will not be a criticism. It's a gift between you and me. Remember to, if you do not understand me, put it in the comments. So, what else would you recommend?
You had made a great point earlier about visitation.
Oh, yes. Visitation is important. So, when someone comes to the hospital, and especially if it's a long time, your visit, even if it's just short, means so much. When I was in the hospital, the cards and flowers means a lot to me. I didn't realize it until after I got home, and I read. I didn't remember. I did not remember, and things that I did. I said, "Oh, this person gave me a card. Oh, this person was here. I didn't remember, but they were here."
Right.
That means so much to me.
It definitely takes a village. Recovery, especially for something like the stroke that you had, can be really intensive. So keeping a much sense of normalcy, having those people, your loved ones, come and visit you as much as you can, keep your spirits up.
That's good. Good advice. And then remember, you are in control. So act like it. Act like you're in control. Then so come with your medications. What have you been through? What's your history? So that the people the medical people can do a good job.
Absolutely.
Well, thank you, Miss Johnson, for your being here, and thank you for agreeing to be interviewed.
Of course, thank you for having me.
Okay, and remember to be a blessing. You are a blessing. Be a blessing to someone else. I always end my broadcast with that word of encouragement. And so please share with us where you're coming from and what your questions are. And I will be checking in the comments and get back to you with the answer, if I can. If I can't,
we'll try to find the answer for you.
We'll try to find it. Don't forget to share this with someone, not just anyone. Share with someone, this will help. Because you never know what tomorrow may bring.
Don't forget to like, comment, or subscribe.
Okay, and thank you so much for being here. I appreciate you. Bye for now. Bye-bye.